A significant impact of the Inflation Reduction Act, or IRA, is the introduction of the Medicare Prescription Payment Plan, a new option for paying for your Part D prescription drugs to help manage your out-of-pocket costs. In this video, we're going to break down what to expect from this new payment option, which will take effect beginning January 1st, 2025, and will clear up some common questions about it. The program is voluntary and opting in is easy. Learn how at the end of this video. The Medicare Prescription Payment Plan gives people with Medicare prescription drug coverage the option of using a payment plan to pay for their Part D drugs. By opting in, they will receive a monthly bill instead and make monthly payments spread over the calendar year instead of paying up front at the pharmacy or through mail order. Let's look at some examples of how the Medicare Prescription Payment Plan works. Monthly bills will vary depending on when someone opts in and how much their drugs will cost. Meet Jane, a Medicare Advantage member whose drugs cost $500 every month. Medicare has set a $2,000 limit for what any Medicare member will have to pay out of pocket on their prescriptions in 2025. At $500 a month, Jane would reach the $2,000 limit in April. Now let's say Jane chose to opt into the Medicare Prescription Payment Plan in January. Instead of paying the $500 for her medications when she's picking them up at the pharmacy, Jane will get a bill from her health plan each month between January and December. She will still end up paying $2,000 in 2025, but instead of making four $500 payments over the first 4 months of the year, she will pay a smaller amount each month for all 12 months. Let's go through another example. Meet John, a Medicare Advantage member whose drugs cost only $4 every month. But in April, he suddenly needs a $613 prescription in addition to his $4 one, so his costs for that month are $617. That's a lot for him to have to pay at once. So, he opts into the Medicare Prescription Payment Plan to help him manage his costs. Instead of having to pay that $617 at the pharmacy, now he gets a bill for $220.89. And for the rest of the year, he continues making his monthly payments. John's remaining monthly bills are based on what he would have paid for his prescriptions, plus his previous month's balance, divided by the number of months left in the year. So, his bill will vary month over month. In July and October, he needs a few more prescriptions on top of his $4 medication, so the amounts that he owes for the rest of the year are adjusted accordingly. By the end of the year, he has still spent $901 on his prescriptions, but it's been broken into smaller monthly payments. The Medicare Prescription Payment Plan is best for people who have high drug costs earlier in the year. Medicare defines high drug costs as spending more than $600 on a single prescription at the pharmacy or through mail order, or being likely to reach the 2025 maximum out-of-pocket threshold amount of $2,000. However, all people with Medicare prescription drug coverage can opt in. The opportunity to opt in is not income-based and is completely voluntary. There is no additional cost to participate. Whether you choose to participate or not, you will never pay more than $2,000 on your Part D prescriptions in 2025. Joining won't save you money, but it can help you budget and ease the burden of any unexpected prescription drug costs. If you miss a payment, we'll send you a reminder. If you don't pay your bill by the date listed in that reminder, you'll be removed from the Medicare Prescription Payment Plan, and you will have to pay the amount that you owe. You won't have to pay any interest or fees, even if your payment is late. You can pay the amount in full or in monthly payments. Being removed from the Medicare Prescription Payment Plan won't affect your Medicare coverage. You'll still be enrolled in your plan. You can opt out at any time. If you choose to opt out before the end of the year, you will go back to paying your drug costs up front at the pharmacy or through mail order. You will also be responsible for any amount previously owed when you were in the Medicare Prescription Payment Plan. You can pay that amount in full or in monthly payments. Even if you leave your current plan and switch to another plan or insurance carrier, you will still be responsible for any amount you owe. If this sounds like a good way to manage paying for your Part D prescription drugs, then you may want to opt into the Medicare Prescription Payment Plan. Here's how. Visit ibxmedicare.com/IRA to fill out and submit our opt-in form online. You can also download our paper form at ibxmedicare.com/IRA. Fill it out and mail it back to either Keystone 65RX or Personal Choice 65RX, depending on which of our Medicare Advantage plans you have. Our member help team can help you opt in too. Just call them at the number on the back of your member ID card. To learn more about how the IRA benefits Medicare members, visit ibxmedicare.com/IRA. Independence Blue Cross Medicare plan members can also call our member help team at the phone number on the back of their member ID card. Visit the IBX YouTube channel for more videos about the Inflation Reduction Act and Medicare.